All right, today on pharmacology, we're going to be going over a drug called Tupam. This is a two-part drug. This is atropine and pralidoxime. Make sure I'm saying that right. You'll also see these labeled as a Mark 1 kit. This is a two-part injector, very similar to the EpiPen. You can see here they're labeled number 1 and number 2. So you'll give them in that order. Number 1 is your atropine. Number 2 is the pralidoxime. You have to use both of these. You can see over here, this is just another brand called the Duodote. And like I said before, this is a very similar to the EpiPen. It's got these little safety caps here, and this here is where the needle would be coming out. One of the things I want you to remember for this is not for your patients. This is a forced drug, which means this is for the emergency medical responders. So this is probably the only drug we carry specifically for us. So if we are exposed, this is for you and your partner. So what do we use this for? The military keeps this on hand for nerve agent gases, such as sarin and VX. And then probably more common in the civilian world, you're going to come across organophosphate poisoning. Organophosphates are the most common thing in your insecticides, your pesticides. So if you're around people using things like Raid, the little Raid cans out in the garden, pesticides, stuff on the vegetation, these type things, and they're symptomatic. You want to make sure and look for signs and symptoms that you're not exposed to it. So we've got a little acronym here called SLUGM. There you go. And that's salivation, which is your mouth watering, lacrimation, which is your eyes watering, uncontrolled urination, diarrhea, GI upset, meaning abdominal cramps, emesis, meaning vomiting, and the M is for meiosis, which is pinpoint pupils. So this is what you want to look for in you and your partner. Up here on the upper right, this is all the signs and symptoms. You may or may not get all of these, but if you were to have a sudden onset of an unexplained runny nose, your eye starts watering, you're getting cramps, very high likelihood that you've been exposed. You immediately want to get yourself out of the area if possible, and then if it's bad enough, you're going to want to administer the Tupam to yourself. All right, so you can see here on the upper left, the needle stays out once it's administered. We do this just like the EpiPen. You can see this needle here is stays exposed. So you want to be real careful with that. If you are not, if you're outside of the truck where you do not have a sharps container handy, you want to make sure you bend this over because it is a sharp. There are, especially like in the military uses, if you're going to give this, or if you're going through a rapid triage and having to give this medication, it's very common that they'll bend the needles like this and then hook them through the patient's shirt, either on the collar or on the pocket, or maybe even on the lower portion of the shirt, and leave that hanging on the patient. And that way we can see, somebody else coming behind you can see how many doses that patient's had. It's not that uncommon for having to need a second, possibly a third dose spread out about every 5 minutes. But as soon as possible, you want to make sure you want to dispose of these properly. All right, ninjas, if you got any questions, always hit me up. Otherwise, get out there and do what you do.